here we are. I'm going to be joined now by our fantastic next guests. I've got a caption to turn on here, and I'm going to be joined by Dr. Aida Suarez-Gonzalez, Dr. Tim Shakespeare, and Zara Page, who is also coming to us from Australia, our second Australian guest. You'll notice all of our Australians are at the very start of the day. All of our American guests are at the very end of the day to accommodate time zones. Thanks very much. Hi, everybody.
Hello, good to be here.
So Aida is a principal research fellow, also from University College London. Zara is a PhD student at the University of New South Wales. Is that Sydney? Is that in Sydney?
Yes, Sydney.
In Sydney. And Tim is the research acceleration lead at Zinc, but also formerly researcher at University College London as well, working on PCA, posterior cortical atrophy. Thank you very much, everybody. I've done the introductions, so what I'm going to do is what I've noticed so far for anybody, anybody watching, everybody got a little thing like this, a briefing with the questions. And what I've noticed is the introductions are merging into the research talks. So rather, I'm going to ask you just very briefly, just tell us quickly about where you work and what you do, and then we'll come back and talk about your research. So Tim, you go first.
Sure. Really great to be here. I've been listening this morning and really inspired by the people you've had on. It's been really uplifting, so it's great. So what I'm really passionate about is, we've heard a lot about kind of research that's happening, developing kind of new knowledge, new ideas. What I'm really passionate about is taking that next step from research that unlocks new ways of doing things to the innovation processes that get these breakthroughs into the hands of people who need them most, in this case, people affected by dementia. And unfortunately, it can take a very long time for ideas to get from kind of a new finding in the lab to benefit people's everyday lives. And it's often a different set of skills and different set of approaches that you need to make that happen. And so what I do in my role at Zinc is to share those approaches with academics to help them make that change happen more often and to make it happen more quickly.
This is helping the people that do research and to get their research out there.
Exactly, to develop new products and services that they can get into the hands of the people that will benefit from them.
Zara, what about you?
I'm a third-year PhD student, so I'm in the nitty-gritty of it all at the Centre for Healthy Brain Aging at UNSW here in Sydney. And I'm very lucky to work with a great team of supervisors and other research and professional staff. And my big focus in my PhD has been working as closely as I can with the community, specifically older adult, diverse community groups, to try and really understand where we need to go next and how I can make my research and my project better, and how we can work out how to support these communities that need additional resources that aren't currently provided.
Thank you. And Aida.
So hi everyone. I'm Aida, and I'm a clinical neuropsychologist, and I'm based at the Institute of Neurology in Queen's Square. And I'm very passionate about young onset dementia. So I've been working with this group of patients for a long time now, both clinically and in research. And in particular, I investigate the intraphenotype variability. This is why people with the same diagnosis have different, the symptoms that they display are slightly different, and the progression is different as well. So the disease trajectories, how they are different between people with the same condition. This is something that is very at the center of the research that I conduct. And the other thing I'm very passionate about is rehabilitation and interventions to support people living with these types of dementia. So in my research, I co-produced training programs, assistive technologies, and neuropsychological rehabilitation interventions for this population. And this makes the core of my work.
Thank you very much. And do you know what? I'm going to stick with you, actually, so you can go on, tell us more. We're very lucky. For anybody who wants to know more than Aida can share with us over the next few minutes, Aida is also one of the bloggers for any researchers who are watching. I'm sure you've already heard of our website, I hope. If you haven't, go to dementiaresearcher.nihr.ac.uk, and Aida is one of the people who writes blogs for us each month, which often not only talks about career topics, but also talks about her brilliant work. So tell us, Aida, what are you working on right now? You've done so much in the past, but what are you working on at the moment? What's exciting you right now?
So at the moment, I'm very focused on developing tele-neuro rehabilitation treatments and therapies to improve the symptoms of people living with these young onset forms of dementia that I mentioned. In particular, I work with people with posterior cortical atrophy, primary progressive aphasia, and behavioral variant FTD. And the way I work and the way I want to develop these therapies is that they are precise and personalized, and that the results benefit people in a way that is meaningful for them. So we are talking a lot nowadays about person-centered outcome measures. So this is very important for me. And I think that something that is very at the core of my way of working is co-production. So I always co-produce these therapies with people living with dementia, and I keep doing it at the moment. And I use participatory methods for this. And in particular, the studies that I'm conducting at the moment. So one of them is, so we are trialing an online training program for families of people with these 3 types of dementia that I mentioned. The program consists of 6 manuals that we previously co-produced with patients and families. And then we place these manuals in a digital space. And by accessing this material, families learn more about how to manage the specific symptoms of the disease in a positive way, in a way that makes a change in their lives. And we have just completed a randomized feasibility clinical trial testing this tool. And the trial took place entirely online. And we are currently analyzing the feasibility data and learning a lot about what changes are needed for a full international trial that will come up in 2024. Another study that I'm conducting is about using precision neuropsychology to select the non-pharmacological treatments that could work best for my patients. So I'm looking at biomarkers, imaging, cognitive profile, lifestyle, and many other factors. And I try to understand how these factors affect the disease trajectories in people with the same condition, and what we can do about it from a behavioral point of view, and how these behavioral interventions can be implemented remotely using technology. And I think the big news in the last year is that I recently added a new dimension to my research, which is innovation. And team played a big role on this. So I received a Healthy Aging Catalyst Award a year and a half ago to transform one of my research outputs. So during my postdoc, I work on the development of a reading tool to support reading in people with posterior cortical atrophy. And we tested this tool this tool was co-produced with people with posterior cortical atrophy, and we tested it in a randomized clinical trial, and it proved effective. And the problem is that the traditional research funding that we usually, the classical traditional grants we apply for, they give you money to prove the evidence, but then you get stuck. You don't have any more funding to do this thing that Tim mentioned before, the translation, the next stage, the implementation into the real world. And these awards are precisely to support academics who want to become entrepreneurs and transform their research outputs into products in the market. So in the last year, I've been working with UKRI and Zinc and with Tim to learn how I can transform this app into a product that can be sustainable, that can be successful as a commercialized product in the market, and we can scale up and have an impact on many, many people. That's Adam.
That's a topic that's getting talked about quite a lot right now, isn't it? Is this challenge of implementation? Because of course the issue here is as Aida said, you, like with this app, you go away, you work with people with PCA, you find something that very much helps people who are in the trial, and then the trial comes to an end, the money runs out, and what do you do with the results? And as academics, you often publish them in journals, but I know so many academics, I know like you, publishing them in a journal is like something you have to do for your job, but it's not really what you want to do, is it? What you want to do is to see that out there in the real world getting used by lots of people. And I guess that's where Tim comes in. But this is something for those who aren't researchers or watching, this is something that's a bit of a discussion right now in the field. There's a more focus on implementation, particularly from the charities that fund this research, because of course it's no good if your brilliant findings just languish somewhere in a journal and don't get used. Zara, I'm going to come back to you, Ida, because I've got a bunch of questions, but I'm going to go to Zara next and ask Zara to tell us more about her work, because it sounds like the implementation challenge is one that you're going to come across by the sounds of it.
Definitely. I think we've already had some challenges, especially part of my PhD is looking at computerized neuropsychological assessment. So the idea that this kind of new or evolving technology for cognitive testing might be more appropriate, culturally appropriate for older adults who come from different or non-English speaking language backgrounds, born overseas, different cultural backgrounds. And the idea being that in theory, these computerized cognitive tests can be very affordable, can be administered remotely by less trained individuals, that you don't have to have a neuropsychologist on hand. So there's a lot of pros to them, but actually in practice, there's a lot of challenges as well. And part of that's also working out whether this group of older adults is comfortable with it. Do they like it? Do they want to use this technology, or do they prefer sitting down, in a room face to face with someone? So that's part of the challenge as well, that you've got this layer of practical challenges to cognitive testing, and whether they're valid, and are they giving us the information that we need to help diagnose people and monitor their cognition over time. And then as well, how are they received, and how can we make the best use of the technology that we have, and what do the future technologies and future iterations need to have to make sure that they're the best they can be. So it's a very exciting space. I'm looking forward to getting my PhD done and then moving on to that next stage of what can we actually do with these tests that are there. Do we need to make new tests? Can we improve the ones we have? It's just so exciting to see what could be done next.
And there's no getting away from these cognitive tests, is there? I mean, we've heard this morning, we've heard so much about eye biomarkers, gait biomarker, all these different biomarkers and different tests and ways to early prevent before the memory problems come. But whichever way you look at it, that cognitive test is still there. It still comes up. Whether we'll rely on it less, or whether it will be how our use of that tool will change over time, remains to be seen. But I think, did you find, what I've come across a lot over the years is people wanting to do that for themselves. And that's always been something we've been very nervous of, the idea that you could just put a cognitive test online. If you go, I imagine that is one of the most Googled things, isn't it? How do I tell if I have dementia? Is there a test I can do online? Is there risks with putting these out there? Are these tools just for clinicians, or are they tools that you think everybody can use? Ida, feel free to chip in on that as well, because I'm sure you'll have an opinion.
Yeah.
I think, Ida, you go.
No, sorry, you go, and I will follow.
I think the big challenge with the tools that we use at the moment, there are lots available to clinicians and to researchers as well in research settings, that we have a lot of tools. And part of the challenge is working out which tool you need to use for who. If you've got a client come in, you've got a patient come in, what is actually the best tool that you need to use? And it's definitely not a one size fits all approach or model. So it's working out how can we guide the selection of the best tools, and out of those tools, how can we tailor them, and are there specific ways that we need to administer a cognitive test for a certain group of people? Do we need to make adjustments here or there? So I think a challenge of having them openly available online, one challenge is making sure that the right testing gets to the right people, and then what we do with that information, that once we get these results, it's not as simple as a yes or no, do you have dementia, that there's a lot of other factors that need to be taken into consideration. So I think it's how do we fit the cognitive testing into that network of all these other factors and indicators, such as lifestyle and background and
And as
So I
you
think
said,
that's quite interesting.
as you say, importantly in your research is how you make them culturally appropriate as well, because that's one of the real issues, isn't it? Is quite often they're not culturally appropriate, and people don't work for everybody. Ida, can you add to that?
I just wanted to add that I think that because we are producing now these digitalized tests that people can use at home, and they can administer the test to themselves independently. I would like to emphasize that these are clinical tools, should always be supervised by a clinician, because we should never forget that the diagnosis of dementia is a clinical diagnosis, and it is not a single test cannot diagnose dementia. You are just getting a metric of a performance in a specific task. And this is something that it is very important to explain to the population, because sometimes you get these people in clinic who've done an online test and they scored poorly, and they come because they are scared. They come to clinic scared because they think they got Alzheimer because they scored poorly on this test. So I think it is very important that we use these tools appropriately and with responsibility. And we don't want to be alarming or harming people unnecessarily. So I think it is important that we look at these tools as clinical tools that can increase accessibility to testing, but always to be supervised by a clinician, by someone who understands about the disease and who can provide due support to someone who is using these self-testing tools.
And so Tim, I promise I'm going to come to you. What's wrong with the tests we use now? I mean, for anybody who's watching as well, don't forget, you can, if you have any questions for any of our guests, you can post those in the chat, or you can use hashtag Chatathon. We're talking about diagnostic tests right now, but we are going to move on to talk more about the interventions that can come from that. What's wrong with the current ones?
With
Ida,
the pen and pencil that well, so first, these are tests that don't travel well across cultures, because most of these tests were developed a long time ago and were designed for Western and well-educated populations in high-income countries. But even within the same culture, these tests often put people with low literacy at disadvantage, because they are pencil and paper tests that resemble pretty much academic tests. So those of us who have received and completed academic education have been exposed to that type of tasks daily for many years. And this gives us an advantage when compared to someone who only completed basic schooling and then went off to work. And some of them are quite old as well, so don't show good neuroanatomical correlations, and they come conceptually from a time when we didn't have the advanced neuroimaging methods that we have nowadays. So there are actually many limitations, but there are also a new generation of tests, many of them computerized, with very good scientific foundation coming up.
Thank you, Tim. So, I mean, Ida mentioned at the start that she's one of the people that are kind of benefited from some of the work that Zinc's. What is the need there? What is the challenge with translating research into practical services, and how can you help people deal with that?
Yeah, that's a great question. I think often there's a different kind of set of skills and approaches that you need for kind of doing research, which often it really is focused on kind of working out what's effective, what works, what measures what we want to measure, what gives us good results, what helps us develop new knowledge, compared to what you need in order to turn that into something that people will use in their everyday lives. I think Zara touched on this really well in what she was saying. It's not just about how can we develop effective tests, it's what do people want, what's desirable to our users, what will they use? And kind of taking a step back, kind of zooming out a little bit and looking at the whole picture, what's going to get this working. So effectiveness is really important, but so is desirability. And there's ways it goes much further beyond just asking people like what they like, what they're interested in, what they might use. But what works really well is actually testing things really early and finding out what people actually use. So that's just one approach that we encourage people to take. And then as well as that, there's also what we call viability. So what is the value that you're producing, and how can you kind of capture that value? How can you find out who's going to pay for whatever it is? Because whatever it is you create, someone's going to need to pay to continue developing it, continue pushing it out there. So who is the right payer? Who are the different stakeholders out there? Understanding that in detail so you can find some kind of business model, whatever that might be, to allow what you create to scale and to reach people that need it. And sometimes that might be creating a social enterprise. Sometimes that might be providing a service that gets paid for by the NHS or social care. Sometimes it might be a service that you provide directly to customers. But we help people work through all of those issues to develop a product that's effective and desirable, and also develop a kind of system or a structure around that that allows you to get out there into the real world.
And I guess that's one of the tricky things, isn't it? I think particularly in the UK, we have a different view to this. I think if you're in some other parts of the world where they have different health systems, there's more expectation that you can develop something which you just ask people to pay for. And if people like it, they'll pay. In the UK, I don't know if it's because we have the NHS, but there's definitely a different view that the kind of people think that these are things that should be provided by the health service. And so because there are so many things you could get on the health service, there's so much competition. So when you do develop an intervention that works, you've really got to make a very strong case for how that helps people, and helps a lot of people, to make it all the way through that journey to a real. Ida, yeah. I'm going to come back to you because you've got Read Clear. We've got 5 minutes left. I'm going to give you a chance to plug Read Clear now. So tell us about Read Clear. Clear Read. Clear Read, not Read Clear. That's right.
No, it's Read Clear. You got it right.
Read Clear. Read Clear. So, I've written down Clear Read.
Read Clear is an app, and it is a reading aid to support reading in people with posterior cortical atrophy. So it is an app that helps people to not get lost on the page, which is a very common problem. People get lost on the page when reading books and news and stuff. So with Read Clear, you get support. You have a reading ruler and you can control it. And this helps you to stay on the line, and also alleviates visual crowding, that is when lines and words clutter up together. And it is also designed in a way that makes navigation easy for people with hand dexterity issues who have difficulties interacting with touching screens. And Read Clear has benefited a lot from teamwork, and it's something that I would recommend to everyone, because what happened when we finished the trial, the research study with Read Clear, is that we got stuck. We were not able to implement. And this is where innovation comes in. So is this changing gears and changing the way you think and approach your research, and your research it stops being a research outcome and it starts becoming a product. This is a transition that you have to make. So you stop thinking about helping your patients, you start thinking about opening to the market, not helping your patients, but engaging users. And this shift of gears, I think, is very difficult for academics. That's why it is, and clinicians, and I think that's why it is very important that you engage with organizations like Zinc, because they help you make that transition. You need to think about sustainability. So when you start doing your research, you don't think about monetizing anything or making money out of any of your research. But if you don't manage to make it sustainable, you won't have anything. You will only have a paper published and citations. But so what? You are not really making any impact. So this is very important. This is strategic thinking, understanding whether if there is a market, is there a market? Because your solution can be very creative and very well grounded in science. But is there a market? Will people pay for it? Will organizations pay for it so users can have it for free? All these things are very important because they are key for implementation, for the success of your products out there in the market. And I think it is a very important journey for research. For my app in particular, it's been critical having the support of Zinc. I've made many decisions and many changes in the app to make it more sustainable. It's a reality check, and it is, and so far the app is there. It is available for free at the moment, but we are working very hard on a business plan.
And if I might add, it's an opportunity that's open at the moment for researchers. So if there's something they're thinking about, if they've got ideas they want to see put into practice. So it's funded by UKRI. It's offers £62,500 over 12 months. Particularly, it's good for early career researchers to get a first experience as being PI. And so I put the link in the chat on YouTube if you want to find out more about it. Yeah, we're really excited to support researchers with their ideas.
Definitely. So if you have a product or service, there you go. And Zara, I guess coming into the third year now, that's because this is traditionally what happens is you kind of get to the end of your PhD and then you end up looking for a job, and the thing you've been passionate about over the last 3 years, if you're lucky enough, you get to somehow continue that. And if you're not, you end up moving on to your next thing, and that gets slightly left behind. I don't know if are you excited for the next phase? Are you hoping to carry on with this?
Very excited and trying to focus on finishing writing up and get to that next part. I think it's been really fantastic in the past year to have opportunities to connect more internationally, and even being, at an event like this is fantastic to, open up and see these, initiatives and that there's so much more than, what you see on your little cubicle each day, writing up your PhD and seeing participants. That I think it's a very exciting time to be a PhD student, soon to be postdoc, hopefully.
And
so
all the skills you need now. You need a ton of skills. You've got to be a science communicator and an implementer and a grant writer for Tim, and be able to engage with people living with the disease as well, to co-design these things and be personable and understandable. It's a challenge. Well done for getting through. Good luck with the next few months. Zara, please do, if there's anything you want to link to share more widely some of the papers or stuff or your project, please do post a link in the YouTube chat or drop it to me and I'll post it in there for you. How quickly did that half an hour go? Thank you very much to Dr. Aida Suarez-Gonzalez, Zara Page, and Dr. Tim Shakespeare. Thank you so much for joining us over the last half an hour. And again, for anybody wanting to know more about their work, go to the chatathon.uk website, where you'll find bios on them and links to all their Twitter feeds as well. Thank you very much, everybody. Our next guests have started to arrive as well. So what I'm going to do is I'm going to take this opportunity to remind you that not only is today about sharing some of the research of these amazing people that are joining us, but also importantly, it's to raise money for 4 brilliant charities. We have Race Against Dementia, Alzheimer's Research UK, Alzheimer's Society, and the Lewy Body Society, who all fund research in the UK, and they do amazing work. And so many of the people that are joining us today, it's funding from those organizations that have made their work possible. Hopefully the donation link is working again now. So if you go to the chatathon.uk website and click donate at the top of the page there, it'll take you off to our charities trust page where you can make a donation, or hopefully it'll be working, which is chatathon.uk/donate will also work. And what I will do is pop a link on the screen in a minute. What we are going to do though, while I quickly leave the room, is I'm going to play you a quick film about one of our charities, and then we're going to be straight back for our next session, which will be from 11:30 till 12, where I'm joined by Dr. Sophia Amenia, Hannah Hussain, and Reza Al-Zain, who are going to talk about a diet for the brain and measuring quality of life. So I'm going to play that film for you now. Which one? That one.
What time should we leave tomorrow?
I think about 8. What do you reckon?
Yeah, that sounds about right. What time should we leave tomorrow?
I told you, 8.
What time should we leave tomorrow?
We're leaving at 8, Jane.
What time should we leave tomorrow?
I think we should leave it, Ayla.
Think about this for a minute. The brain has masterminded everything we've ever known, everything we've ever discovered, ever created, every idea that's ever been, everything we've ever felt, ever seen, ever heard, ever said, or dreamt. So when it comes to Alzheimer's disease getting the better of our brains, well, you can't outsmart the smartest thing in the universe. Which is why the brightest minds behind Alzheimer's Research UK are making incredible breakthroughs. Alzheimer's doesn't stand a chance. We can all use our brains to do something amazing. Simply share this film and spread the hope.